Hi everyone, thank you for taking the time to view our poster. I'm Emily Cloward, and I'm excited to briefly tell you about our project. We sought to investigate a possible connection between peripartum antibiotic use and postpartum depression. Currently, antibiotics are the most commonly prescribed medications in the peripartum period, and postpartum depression is the most common mental health issue encountered in postpartum women. We conducted a retrospective chart review involving postpartum women and evaluating several different variables. Two variables of note were whether or not the women had received antibiotics within 1 week prior to delivery to 5 weeks post-delivery, and whether or not they had postpartum depression, which was defined as an Edinburgh Postnatal Depression Scale score of greater than or equal to 12, or having postpartum depression on their problem list. It was found that patients who had received antibiotics had a 6% higher chance of developing postpartum depression. Our study also collected several other variables that were found to contribute to a woman's likelihood of postpartum depression, including an increased risk with a prenatal history of anxiety or depression, an increased risk for women on Medicaid versus commercial insurance, and an inverse relationship with the mother's age. Older women were less likely to develop postpartum depression. In conclusion, we found that in our sample, women who had received antibiotics were statistically more likely to have developed postpartum depression. Results of our study could be used to stem further research and to help women in the future in the postpartum period. More details about our project are available on our poster. Thank you again for taking the time to view our project.